Hey guys, Tony Maritato here, physical therapist, and I want to take a minute to talk about some options you might have if you've exhausted your insurance coverage for physical therapy services after your total knee replacement. So I know Medicare does not have an actual limit. The limit would be medically necessary. As long as your services continue to be medically necessary, Medicare will cover the delivery of physical therapy services. But non-Medicare plans, often Medicare Advantage and commercial plans, do often have a visit limit of some kind, either 20 visits, 30 visits, some are 60 visits in a year. And if a beneficiary runs through those visits and believes that they still require physical therapy services, there are some options. So let's talk about those options. Obviously, number one is you have the option to self-pay for physical therapy services. Now, depending on where you go, what kind of facility you go to, self-pay prices will vary drastically. I'm going to give you two extremes. So at my clinic, if somebody's exhausted their insurance coverage and they want to continue to come to physical therapy services, we have a program that allows them to come as much as they need for $100 a month. You are not going to find another program like that anywhere in the US. If you do, let me know about it and I'll promote it. But we do it because we want to provide services to beneficiaries who have exhausted their insurance coverage. We want to make sure that people get the care that they need. I've always had the philosophy that if you're willing to get in the car and come to my clinic, I'm going to take care of you. We also can do it because we have other things that we do. We're not just a physical therapy clinic, so we're not fully dependent on physical therapy services for all of our income. But that being said, one option that you can try is if you believe the most important thing that you need is manual therapy, for example. You need somebody to mobilize the knee, stretch the knee, do the things that you can't do for yourself. You can usually go to a physical therapy clinic, especially a private practice, and specifically request that they do 1 unit of therapy. And that 1 unit of therapy that they deliver is the unit of manual therapy if that's what you believe you need. You can pay for that out of pocket. Typically, most hospital-based facilities or private practices will allow you to pay at the time of service with what's called a prompt pay discount. It's usually about 40%. So even if that particular facility is charging $100 for 15 minutes, you can usually get that down to 60 or sometimes even less. Most private practices are charging about $50 or $60 a unit, which means that you're usually going to pay somewhere around $30 or $40 out of pocket. So it just depends, but you can absolutely negotiate. Other things that you can do is you can talk to the physical therapy clinic director, manager. You can see if you can negotiate a deal where maybe you would attend physical therapy at the less popular times. If the clinic you're going to has a traditional 3 p.m. appointment that nobody wants to take because everybody wants mornings or they want after work, maybe you can negotiate a lower rate for that 3 p.m. appointment, or you can go on a last minute call list. So if a physical therapy clinic like mine gets a last minute cancellation, in a way to fill that spot, we have a last minute call list where we could call you, and if you can come in, we can provide you with a discounted service because you've helped us fill an opening that would have gone otherwise unused. So the main thing to know is there are options. I would start calling around. I wouldn't be married to any single location. Just because you had insurance covered services at one clinic doesn't mean you couldn't go to a different clinic for non-covered services you're paying for out of pocket. You could also look beyond physical therapy. There are amazing personal trainers. There are amazing athletic trainers. There are amazing licensed massage therapists, occupational therapists. There are all kinds of other professionals that you could choose to work with that could continue to progress you toward your goal, but do it in a way that is more affordable, more accessible, and easier for you to manage. So the most important thing is you have a clear understanding of what it is that you want, what it is that you need. And I would recommend, if you know you're running close to the end of your existing physical therapy coverage, talk to your physical therapist, because part of their programming, part of my programming, is planning your discharge and what we're going to do after discharge. Whether you're going to stay at my facility and continue to work with me on a self-pay basis, you're going to transition to another facility working with a different physical therapist, or you're going to go to a non-physical therapist who's going to continue to work with you on the things that you need to do. There are lots of options. And of course, the ultimate option, you learn your home exercise program, you continue to do it on your own, you get back to your recreational activities like golf and pickleball and tennis and all the things that you enjoy, and you find that that is enough to keep you progressing on track. Either way, if you have specific questions, if you have questions about insurance or cost or anything like that, go ahead and post them in the comments below. I will catch you guys on the next video.